disability and rehabilitative services, and am co-leading the Training and Pathways Action Group for the Family and Social Services Administration. I would like our other partners in this project to introduce themselves, so I'm going to turn it over to Peggy.
Hi, everyone. Thank you so much for being here. I'm Peggy Welch with Family and Social Services Administration. I have the title of Chief Advocacy Officer, which allows me to do a variety of things. And I have the great honor of being the point person for the DSW workforce development. So we'll talk more about that in just a few minutes. Thank you. And I'm going to turn it over to Erica. Would you say hello, Erica?
Sure. Hello, everyone. Erica Reeves. I'm a senior consultant with Health Management Associates in the Baltimore, Maryland office, and have the pleasure of working with Peggy, Kelly, and the Bowen Center and others on this project. And I believe I'll hand it back to Kelly.
Thank you, Erica. So that's our internal, if you will, project team, but we are also, as Erica referenced, working with and partnering with the Bowen Center. They are providing research and support for our training and pathways activities. So I would like for them to introduce their team. I'm going to turn it over to Courtney.
Thanks, Kelly. Hi, everyone. My name is Courtney Madlock. I serve as Assistant Director of Policy and Strategy at the Bowen Center, and I'm serving as the Bowen Center point for the training and pathways activities. So I'm helping to lead the research team. And with that, I'm going to kick it over to our director, Hannah Maxey, to introduce herself.
Hello, and I guess it's just afternoon. Good afternoon. It's nice to be with you all today. I serve as the director of the Bowen Center for Health Workforce Research and Policy at Indiana University. Our team works closely with the state of Indiana and stakeholders on healthcare or health workforce related issues. We're delighted to be partnering with FSSA and all of you on direct service workforce initiatives, and just excited to be here today and learn from you all. I'm going to go ahead and pass the baton to our colleague, Becky.
Hi, everyone. I'm Becky Bustani. I also work for the Bowen Center. I'm a policy analyst, and my primary focus is to assist with the Training and Pathways Action Group. And with that, I'm going to kick it over to Brittany.
Sorry, everyone, I had some trouble unmuting, finding where my mouse is on all my screens. I am Brittany Dalton, and I am a faculty member in the Bowen Center. And I'm also here to assist in the research and the development of the Training and Pathways strategy.
And last but not least, we have our colleague, Marnie, who you probably have received some email communications from. Marnie, do you mind introducing yourself?
Absolutely. Thank you, Courtney. Hello, everyone. My name is Marnie Baker. I'm the program manager at the Bowen Center, and I just oversee all of the projects that we have here, and I'm delighted to be working on this one.
All right. Thank you. So that is our hardworking team at our Training and Pathways Initiative. We're going to move forward now. Each of you as action group members should have received a list of the other members, but for this very first meeting, we'd like to do a quick introduction, and I'm going to have my colleague Erica facilitate that through a roll call. So Erica, if you would, please.
Sure. Thank you, Kelly. So I'll just call out names. If you could come off of mute, please, and share your organization and title, that would be great. So first up, Al Bracken.
I am here. I'm with Anthem, and I'm the Director of Provider Relations for LTSS.
Thank you. Amanda Wills.
Hello, Amanda Wills with Anthem, and I am the Workforce Development Manager.
Amy Kent. Amy is with the State Department of Health. Amy Rapp. Amy Rapp is with FSSA. Angie Eads is with United. April Young.
Hi, everyone. April Young, and I'm with Advancing States. I'm the Director of Strategic Initiatives, And we've been helping out with the Indiana Direct Service Worker Advisory Board.
Ashton Driscoll.
Hi there, I am with OMPP. I am the Senior LTSS Provider Relations Specialist.
Brian Carnes. Okay, Brian is with NRF. Brooke Schweithkarth. Sorry if I mispronounced, please correct me. Okay, Brooke is a member of the DSW Advisory Board. Danielle Saunders.
Hi, I'm Danielle Saunders. I'm a member of the DSW Advisory Board. I'm a QIDPD for the Hopewell Center in Anderson.
Darcy Tower.
Hey, I'm Darcy Tower. I am the Director of Provider Experience with Indiana Medicaid. Good to see everybody.
Deanna Kirkwood.
Hello, I'm on the Indiana Direct Support Workers Advisory Board, and I also work as a QIDP for Gateway Services in Franklin.
Denise Arland. Denise is the mother of a person with lived experience. Donnie Davidson.
Hello, I'm Donnie Davidson. I am the Senior Intake Transition Coordinator for ViaQuest Insights Consulting.
Eric Esley. Eric is with Leading Age. Erica Young. Evan Reinhardt.
Hi, everyone. I'm the Executive Director for the Indiana Association for Home and Hospice Care.
Laura Jones.
Good afternoon. Flora Jones, Director of Student Pathways and Opportunities for the Indiana Department of Education.
Ginger Fassig. Ginger is a member of the DSW Advisory Board. Jan Kulik. Jan is with the Department of Health. Jennifer Northcutt.
I am a DSW Advisory Board member. I also work at the Village of Maricha here in Indianapolis as a DSW and also a team lead.
Jessica Harlan York. Jessica is with FSSA. John Barth.
Yep, John Barth from Molina Healthcare of Indiana.
Jordan Stover.
Morning, everybody. I'm Jordan. I'm from the Indiana Department of Health. I'm the Assistant Commissioner for Consumer Services and Healthcare Regulation.
Giovanna War.
Giovanna War, Direct Service Worker Advisory Board and Director of Operations for Indy Superb Care Agency.
Julius Edwards. Julius is with Ivy Tech. Catherine Tavidian.
Hi, I'm Catherine Tavidian from FSSA.
Kaylee Sandlin. Kaylee is a provider with Home Helpers Home Care. Kim Dodson.
Hi, good afternoon. I'm Kim Dodson. I'm the CEO for the ARC of Indiana.
Kristen Lais.
Hi, everybody. I'm Kristen Lais, CEO of the Indiana Association of Area Agencies on Aging.
Leslie Huckleberry.
Hi, good afternoon. I'm the Director with the Division of Aging with FSSA.
Lisa Metcalf.
Hello, everyone. I am the Assistant Director for Employer Engagement at the Department of Workforce Development.
Marilyn Pizzulo.
Hello, everybody. Marilyn Pizzulo. I'm the Associate Chief for Workforce Strategy at the Indiana Department of Workforce Development.
Matt McConnell. Matt is with Ivy Tech. Megan Berger.
Hi, I'm Megan Berger. I am representing Self Advocates of Indiana and also for the ARC of Indiana too.
Michelle.
Good-
Michelle Holtcamp.
Hi, everybody. Michelle Holtcamp. I'm the Director of Communications for FSSA.
Michelle Leonard Smith.
Hi,
Hi, everyone. My name is Michelle Smith. I'm the CEO for Ability Services in Crawfordsville.
Ross Westreach, right? Sorry.
No problem. You had it. Good morning, everybody. Ross Westridge, Humana Plan President.
Sarah Cannon.
Hi, I'm Sarah Cannon. I'm a member of the DSW Advisory Board and also a senior DSP with LEL Home Services.
Sean Fulton.
Yeah, hi, I'm Sean Fulton. I'm the past president of Self Advocates of Indiana and the education and training coordinator for the ARC of Indiana.
Stacy Townsley.
Hi, good afternoon. I'm Stacy Townsley with the Indiana Commission for Higher Education, and I serve as the Associate Commissioner for Adult Strategy.
Suzanne Williams.
Hi, I'm Suzanne Williams, and I'm with the Indiana Department of Health, the Consumer Services and Healthcare Regulation Commission, and my division oversees CNA, QMA training, testing, certification, and the registry.
Harry Williams.
Yes, I'm Terry Williams. I am the Associate Vice President for Care Management for Humana.
Zach Arland. Zach is a person of lived experience. And is there anyone who I failed to mention? Please introduce yourself. Thank you. Okay, thank you so much for the introduction.
All right. Wow. As you can see, we have a wide and varied group, and so I'm looking forward to the diversity of input. I think this is going to be an amazing work group. So let's just go ahead and get started. We have a limited amount of time. I want to talk just a little bit about the Training and Pathways Action Group, give you some background. As part of our Direct Service Workforce Initiative, which Peggy Welch will speak to here later, and our goal to improve the overall experience for individuals that we serve through the attraction and retention of the direct service workforce, we birthed, if you will, the Training and Pathways Action Group. But I wanted to speak specifically today about some legislation that was passed, House Enrolled Act 1342, in our most recent session. That act, while directly targeted and focused on the direct support professionals within the Division of Disability and Rehabilitative Services or Bureau of Disability Services, asks us and directs us to create a statewide core training curriculum for direct support professionals, and that we also identify a platform, a vendor to launch that statewide curriculum once we have it developed. There are some specific timelines that are in place. We need to obviously have the core curriculum, core components, the foundational pieces identified very early in this process, but we need to be ready to release a request for proposals for vendors to provide the training services, the training platform by January 1 of 2024. And that we are ready to enter into a contract with a vendor or vendors for said training program by the 1st of January 2025, with a launch of that training program by July 1st of 2025. So we within our division began to lay out a path forward, but we obviously saw the connection and the opportunity to connect within the Direct Service Workforce Initiative as one of the tenets of the attraction and retention of our direct service workforce is training and pathways. In addition to that, I want to speak a little bit to the intersection with another large project that we are navigating and launching within the Family and Social Services Administration, and that is the Indiana Pathways for Aging. And through this model, it is our goal to increase the percentage of individuals who are aging in Indiana, who are able to do that within their own homes and communities, rather than within an institutional setting or a nursing facility. The target is that we will reach 75% of older Hoosiers who are seeking supports to remain independent in their communities, that they would receive that within their home and community. That is not our current status. And in order to achieve that objective, we would need to attract a larger direct service workforce and also work to potentially retrain, redirect, refocus some individuals who have historically provided direct support in other settings. Obviously, this is a natural connection, and this was the impetus, if you will. This was what birthed the Direct Service Workforce Initiative, but it certainly does not only apply to the Indiana Pathways for Aging. We are looking across all of our home and community-based settings. So with that, I'm going to turn it over to Peggy, and she can speak with a great deal of passion about our Direct Service Workforce Initiative.
Thank you so much for being here. And yes, I am passionate about this. I could talk the whole hour just about how we came about and what's going on. I'm going to hit some highlights because most of you have been engaged with us in different ways. So please listen as I talk fast. You've got the slides that give you information, and we're going to be talking a lot more about this as we continue to work. So in 2021, July, Dr. Rusiniak came and said, Peggy, we've got to grow the workforce. Would you be the person? I said, yes. We jumped right in. One of the first things that we did is then engaged with the Bowen Center to be able to help us develop the Indiana Direct Service Workforce Plan. The way that I always said it from the very beginning, the question was, how might Indiana do better at recruiting, training, supporting, and retaining a robust and sustainable direct service workforce? And Bowen Center worked with us all through 2022 to develop this plan, and then we launched it publicly in November of 2022. And now we've moved from the planning to the development of the strategies and eventual implementation. So we're real excited about that. I did an MCE, and with Kelly, we did the MCE onboarding and have a really nice slide deck. Some of you've seen it, but we want to make sure that we send it to you as the members. That'll give you some more information about what we're doing and how we're planning to move forward. One of the things I'm excited about in that slide deck, at the very end, we have a lot of how might we questions. One of the main questions for us is how might we ensure that direct service workers are an integral part of the care team for home and community-based services, which leads me to explain to you again and make sure you understand that we started in January 2022, the Indiana Direct Service Workforce Advisory Board. And several of them are here who volunteered and had an interest in this particular work group. We made a commitment that everything that we do, every decision that we make has been reviewed and received input from this Direct Service Workforce Board. We want to make sure that we're not telling people what we're going to do for them and then they're going to like it. We're asking, how do you feel about what we're doing affects you and your colleagues? We have a commitment that we made that every workforce group that we have and a work group that we have is going to have at least one DSW board member, and every work group will also have persons with lived experience in everything that we do. We did lots of stakeholder meetings through 2022. July of 26, we had a great big brainstorming session, and several of you that are on here, you were a part of that. And so out of that came these 3 action areas. We had 25 strategies. We then compressed those strategies down into 3 action areas. Wages and benefits was number 1, and yay for the finance team of FSSA. Thank you to the legislature And then as it moves on to CMS, it looks like we're going to have a rate increase for HCBS and then for others. So real excited about that. You can see in this particular slide, different opportunities that go along with those wages and benefits, money stuff. And we'll talk more about that in another meeting, but you can read it there and then we will jump in another time. If you'll go to the next slide, the DSW plan, promotion and planning. Thank you, Michelle Holtkamp, for being here. Michelle is the director of our communications division. We're going to be working closely on a very aggressive marketing campaign, but first we need to launch the campaign that's really exciting. So hang on to the aging, Pathways to Aging. So you're going to love that. And we appreciate Leslie being with us, also the director of aging. But again, you'll see we've got a lot of fun stuff that's going to go on there. And if you'll go to the next then. So this is why we're here, this DSW plan, training and pathways. And we've got so much that we need to accomplish today, but we are so excited about what we are going to accomplish because we have to accomplish it if we're going to do a good job in the state of Indiana. So thank you so much. And now, Kelly, I'm going to hand it back to you. And thank you for giving us the opportunity to do this.
All right. Well, let's keep moving forward then. Let's talk a little bit more specifically about the Training and Pathways Action Group, give you an overview. We'll move to the next slide. So what, you may ask, is the hope for this action group? Why am I here? You've heard me speak, you've heard Peggy speak. Always, and I want us to keep this ever present. Our goal is centered on the individual. This is person driven. So the overarching outcome is that we want to improve the experience for the individual. And we also want to recognize, elevate the value of the DSW role and be able to provide a career or a pathway so that we can enhance the quality of lives of those DSWs. So again, the person at the center, the individual first, our customer, and focus. Peggy, I loved what you said, right alongside the DSWs. So you can see our vision statement here. I'm not going to read it to you, but want to hit the highlights. And the overarching goal here is that we want that direct service workforce to be proficient in identified core competencies and that they would have options, I'm stressing options, to pursue professional development opportunities, which could be specific on-the-job training to add value to their current role, or it could be a professional development that could help them pursue another career path, an academic study. So we want, at the end of all of this, that the supports and the services that we provide in those home and community-based settings and the employment arrangements that are connected to those home and community settings are of high quality and that they're reliable. So that's why you're here today. We wanted to talk about how do we get there? How do we get there? So if you would, next slide, please. Let's talk a little bit about why you're here and your commitment. First of all, let me speak to our commitment on behalf of the Family and Social Services Administration. We have from the beginning, as Peggy stated, and we hope that you see through all of our actions, we are strongly committed to engaging stakeholders and members throughout this process. And we do recognize how busy each and every one of you are. And we most sincerely appreciate the time that you've committed, not only to today, but to future meetings. I'll be quite honest with you, we have a rather aggressive timeline. If you'll refer back to my discussion about House Enrolled Act 1342, we've got some specific deadlines. So we do have a rather aggressive time frame. Our goal, our hope, is to have a series of meetings where we can get feedback from you and guidance on this training and pathways activities. Not only those that have been required by the legislature, but those that will support Indiana's direct service workforce broadly. Thanks to the Bowen Center, I've got to give in particular shout out to Courtney We have charted out a likely timeline that looks to host meetings about 1 per month. Likely in the first 6 months, there's going to be rather heavy engagement. And if you'll recall, we had that RFP release date of January 2024. So as you might imagine, between now and the end of the year, we need to be busy, very busy. So it's going to be rather aggressive. And then we look and anticipate, we anticipate the potential for some ad hoc engagement opportunities after that, as we think about those micro and macro credentials. How might people work toward a career path or adding credentials to their core competency? So we will, thank you for putting up the roadmap. We'll continue to provide direction as to our goal for each meeting. The Bowen Center is here to keep me in line, to keep us all in line, and they do an excellent job of providing research and support and a structure for our meetings, and to ensure that this is on everyone's calendar. So as you can see, here is an illustration of the timeline and our anticipated roadmap, if you will, that we hope to discuss in today's and the upcoming work group meetings. And I hope that you will note where we are today. Those of you that use GPS and MapQuest, that the topic for discussion today is the development of an umbrella terminology and definition for the direct service workforce. So before we move on, I want to talk just a little bit, thank you, Courtney, about the scope. We've mentioned this previously. The Family and Social Services Administration intends that this training and pathways work will extend beyond direct support professionals. And I state that clearly because of the legislation that I referenced is exclusive to direct support professionals. However, our work today extends beyond those direct support professionals. We are using this as an opportunity to integrate the efforts to achieve a common goal. We need to recognize that currently we have no state standardized training for direct service workers that provide direct support services under other titles and provisions. And there are large numbers of those titles: personal care attendant, direct support professional. So at this stage, what our hope is that we can streamline our efforts and maximize the impact of our work. And I think we need to move on to the next slide, Courtney. Am I ahead of myself? No, maybe not. Sorry, I guess I'm not. Did we have a slide? I'm sorry, I may have lost my place. Okay. No, I think I'm referencing a previous slide. We made some adjustments, so that's my fault. Excuse me, just ignore me, folks. So I just want to talk a little bit more about the scope. So we're focusing, as I said, not only on the direct support professionals, we're looking at different populations, aging, chronic health conditions, and those with intellectual and developmental disabilities. This is across a variety of settings, home and community-based. And that would include group homes, private residence, adult day centers, workplace, and assisted living. So. All right. I think we're ready. Umbrella to develop. So let's talk a little bit about the goals of today's meeting. What we would like to do is gather your feedback on a term that can be used to describe our home and community-based setting workers for future training and pathways activities. Now, I do want to state here that we're going to be free to brainstorm and gather thoughts, but we, at this point, this group wouldn't be making the final determination on any title. We might make recommendations, but this is for us as we move forward, a common term that we can use as we move forward in our work in the training and pathways initiatives. So instead of some of the wordy descriptions that are within all the regulatory roles and references, and those of you that have been around for a bit, we know how wordy that can be, that refer to the group of workers that we're referencing as the direct service workforce. What we hope is to settle on one single term and definition. So this to us is a critical first step in order that we can organize future conversations about the training and pathways activities. So now it's time to quit listening to me and get down to work. So I am going to turn it over to the Bowen Center, and I believe that Becky is going to facilitate us through.
Thank you, Kelly. Yeah, let's go ahead and get started. In order, I'm just going to provide a really quick overview of the research that our team did to provide an initial framework for how other states have settled on the term for their direct service worker. You received a memo last week that had in detail, I know that this slide is hard to read, but in that memo that you received, you saw all of the, we had 11 states and one piece of federal legislation that looked at titles that other states are using and definitions that they use to describe this umbrella terminology and to describe this umbrella workforce. Now, just to be clear, again, direct service workers, we're looking at direct service workers that provide multiple services for multiple populations, which includes individuals with physical or intellectual disabilities and the aging population. So you won't see the term DSP in any of these because that's role specific. We're looking for a term that will encompass both the aging and the disability groups. In our research, we identified, like I said, 11 states and one piece of federal legislation. It's a little overwhelming to look at. So what we did was we used a coloring system to organize the information. As we were looking through the different definitions from other states, there were a few parameters that stood out to us. So what we did was we took anytime that a service was mentioned, most states did mention what kind of service this direct service worker provided. There was language outlining specific services. Those are in green and that sort of off green. We noticed that some states provided settings to be very specific on which settings we were talking about for the workers. We also, in blue, we noticed that some states clarified the populations that served, populations being served. There was inclusion and exclusion of specific roles that is in the orange, that is highlighted in orange. And then there was also compensation. So some states indicated if the definition applied only to paid caregivers or to unpaid and volunteer caregivers who may be out of scope for the standardized training that we're talking about. With that, I'm going to turn it over to my colleague Courtney to start the discussion.
Thanks so much, Becky. All right, time to have some fun, guys. I'm really excited. This is a really exciting day at the Bowen Center because we focus a lot on research, but at the end of the day, research needs to be informed by the stakeholders that are boots on the ground and are interacting with and working with DSW. So we're very excited to get your all's feedback, and we're now at the portion of the agenda where I'm going to help us to facilitate some conversation. So as Becky had mentioned, all of the state-specific definitions were shared with you all as a part of the research memo. And we did try and do color coding to help organize the information for your review and your thoughts. But I realized that although the colors might be helpful to some, they might be overwhelming to others. So please don't worry, we are going to help do the dirty work in terms of getting all of your thoughts and feedback. The purpose of today's conversation is really just to start that conversation. So we really want to get your thoughts, your feedback on what might make sense for either a title and terminology or a definition of direct service workers. And I want to be specific here because I feel like the term title and terminology might mean different things to different folks. For our employers, you might start thinking about job titles. And for individuals who are DSWs themselves, you might start thinking about the title that you were hired under or operating under. Here, we're really talking about a conversation starter. So this is really a term that can be used for the remainder of the action group activities and what might make sense for us to organize the conversation. As Kelly had mentioned, it's kind of challenging to have DSPs and then also personal care attendants from the disabilities and the aging space. So instead of us providing all those caveats for future meetings, we're hoping that maybe today we can just figure out what term might make sense and not land on a term today, but rather get your guys' thoughts and feedback on what feels comfortable, what values should be taken into consideration for that. So with that, I'm going to move us to our next slide. Sorry, I'm navigating a lot of screens here. All right. So first I want to share, if you did have an opportunity to review the research memo in advance of today's meeting, you will see that we had an initial draft for consideration. Our intent here is really just to provide one term that can serve as a launching point for our discussion and perhaps a starting point for feedback. We have some questions in here for discussion questions, and I'll get to that in a second, but I kind of want to just share what the structure of the facilitated discussion will be. So first, we're going to start with the terminology or the title. And then if we have time, we're going to move on to the definition piece. And I want to clarify, this is the first conversation. There will be time for electronic feedback and future conversations and discussion. And really at this juncture, it's just a working term that we're planning to use. So I have the information here on the slides, but I'm actually going to stop sharing. And my colleague Becky is going to share a Word document so that she can capture notes and feedback live from everyone. So as you're kind of thinking through your thoughts and feedback on what that term might be, Becky's going to take notes on that, and then we are going to share this as a follow-up to our conversation. So starting with the terminology or title, what we have here as a launching point for our conversation is potentially utilizing the term home and community-based services professional. And Becky, I see we have a note in the chat. I know it's hard to see when you're screen sharing. Could you zoom in and maybe just focus on one page at a time? Is that better for folks? Awesome. So with this first term, home and community-based services professional, this would be, again, we're talking about a term that would cut across both those direct service workers in the aging space and the disability space. What thoughts do you have? Yes, I see Sean has his hand up.
I just think we should make all of this simple, not make it difficult for the direct support for professionals to be able to understand the definition and just everything that we're going to be writing down. I think we should just make it as simple as possible so they don't get overwhelmed trying to read stuff, or you know what I mean, right?
Absolutely, that makes sense. We'll definitely make sure that's a value that's captured in these conversations. Thank you. Yes, Kristen.
So I'm thinking about things like the outcomes of the service. So I'm thinking about things like community living supports partner or community living supports professional, or, you know, what is it we're trying to affect for the people being served? And that is that they get to live and age in their own homes and communities. So that's one thing I'm thinking about. The other thing I'm thinking about is the relationship between the worker and the person who is receiving those services. And thinking about things rather than a worker or an aide, more like a partner or a, words that evoke more of that kind of relationship, as opposed to and having it be more of a joint effort, because it seems to me that work is a joint effort between the person being served and the person providing the service. So those are some of the things I'm thinking about.
Thank you so much. And others, please feel free to chime in. You don't need to raise your hand for this conversation. We hope that this will be, I know it's kind of a big group, but we're hoping that it can be a group discussion.
I think one of the challenges with having such a vague description, such as like community-based services that could encompass anything. I previously did therapy, and as a therapist, we did community-based services. So I think that's something to just be aware of.
I also feel like sometimes it's very vague. I recently was trying to assist my grandmother in getting home health services, and I still kept calling it home health. And apparently they call it personal care attendant now. But then her occupational therapist is the one that came in to do the showers with her, and it was just like, when I would ask for services from a company, they were like, we don't offer that. We don't offer that. When they do offer it, they just don't call it what I was calling it. So.
I think that's a really great point that I feel like also intersects with, and I know Michelle had to hop off from the marketing plan, but I think that's a really great point that even when some sort of definition or term is established, there will be a need for broad-based communication and a broad understanding of who is included in that term. And that is where the intersection with marketing lies. Thank you so much.
I think for those of us who work specifically with people with intellectual and developmental disabilities, we specifically chose the word professional when we talked about our direct support people, because we wanted to make sure that there was just that sense of seriousness of how important the job is. And that's why we had always worked around professional rather than worker. I think HCBS, so the home and community-based services, I think that's long. I think we know, right, that's where, funding might be coming from for these, but I don't know if I necessarily agree that it needs to be a part of the title, because I think that's where some confusion could be lost. We're trying to move away, and this just from some conversations we had with some people with lived experience and self-advocates, that when we keep utilizing the word in the community, we want people to work in the community, we want people to live in the community. People think community is a place, right? All of us live and work in a community. And so instead of differentiating and specifically saying community, if we can try to find a way to not do that, because again, there's people who I don't want to say they take offense to it, but again, all of us do it together. That is it really necessary to define in that way. I hope that makes sense.
Jennifer, I want to, who just spoke of our DSW, not you, Kim,
okay.
But about, was it you, Deanna, that it's real important to use the word professional. No, Kim, you were talking about it. It's important to use the word professional. And we've heard that over and over from our DSW advisory board, that they want a different title that really indicates that they are professionals. They are providing incredible, essential supports and systems. And also I noticed in the 11 that were listed, the word care is used a lot. And I think, Kim, if I'm quoting some other people correctly, care is not a word that really folks like to have used, especially in the disability community. So I want to be cognizant and careful of that.
I appreciate all the sensitivity you put into this.
I too agree with the word professional, as I am a DSP and I've been doing this for 20 years. So this is my career. And I do take it as this is a professional position that I do. I put a lot of care into what I do. And I do also like the word support, because I am not there to do everything for that person, but to support that person in the community, at home, in many different situations. So those are two important things to me, is the support and the professional.
I have to agree with the professional as well. We spend a lot of our time supporting the people that we're working with. We spend time working with their finances, working with their medical care, extending our own training, whether within our company or just broadening our education. And by taking away the word professional, it really downgrades what we do. And people don't look at us as if we know what we're talking about. And that happens a lot when we take our consumers to doctor's appointments, hospitals. We get undermined and looked at like we know nothing, but we're the people that are here with them 24/7, more than some of their families. And I don't mean that any disrespect. Some of them just don't have the family. And we're the ones here working day in and day out, not the doctors, not the nurses, not the home health aides that come in for a few minutes. We are here, and taking away professional makes us seem like we're nothing.
I agree with that. In fact, I've been called a sitter before at a dialysis treatment facility when I'm there to help advocate with my individual I'm supporting.
Thank you guys so much for sharing that feedback. I do have a question, because I know we've heard a lot from DSPs or individuals serving individuals with disabilities. Do we have any folks on the aging side that has thoughts or feedback around the term professional? My understanding is that that's not really a term that's currently adopted on the aging side. So I'd love to hear folks from that perspective and what their thoughts are around some sort of term or professional, special. I think currently they're called personal care aides, personal care attendants. So what are thoughts around that as a united term?
I just want to chime in real quick, because I have worked on the A&D waiver side as well. And our company, LEL, that I work for and have worked for several years, we also are called DSPs on that side as well, not attendant care, even though I was under the attendant care services, because they too understand that we need the term professional and support, because we are providing both for both sides. If I'm working on the DD waiver or the A&D waiver, that I am supporting and providing support to the people I serve.
Hey, Evan, are you still on? Because I know we've had conversations about this, especially from the aging community.
Sure, I'm here, Peggy. The terminology that's most consistently used on that we hear from our members tends to be caregivers or some version of that. So, but I fully agree. Professional is something that I think should be included. The only thought that I had was, how can we in a shortened, concise way distinguish between those that are out there doing exactly what the folks have been describing here in terms of providing support and being that really that major person that folks rely on, and distinguishing between those folks and the folks that maybe are a scheduler or a biller or something along those lines. So that was the only thought I had. But caregiver is a pretty consistent term that gets used to describe folks more broadly.
This is Angie with United. I'm sorry I joined late and I didn't introduce myself, but I think all of you have great points. And I think that representing all that direct care workers, direct care support staff do is, they have so many roles. So I think it's important that we recognize that this is a holistic, right, role. They don't just take folks to the doctor. They don't, just take individuals to the grocery store. It is truly a holistic, person-centered support staff. So I think it's very important that we recognize that. And then I think from my personal experience, recently coming from a provider agency, but also coming from an HCBS role at United prior, is that I think that although our aging population maybe don't recognize that professional terminology, I do think that there is amount of respect that they would offer, right? If we went in that realm, just like that role should be one recognized and given, as we do with the folks who have ID and DD. So, I mean, I think we just need to make sure that we're encompassing all aspects of this role. And I don't know how you do that, because certainly there is so much that is provided by support staff outside of just the normal day-to-day, just a crucial thing, a crucial pillar in what we do.
I do have a suggestion that I think I have worked on both ends as it relates to being on the attendant care side and calling staff caregivers, and also being a part of the BDDS side and direct support professionals. But I think that one of the things that I realize on both sides, no matter what, the payer source may be different, usually the care is still individual specific. So I always, I never, like, one of the terms that I always thought was professional to use was client service professional, because it really is individual specific. And if you provide direct supports in any realm, then you fall into that client service professional, because any service that you provide should be person-centered to that individual. It may look different, the payer source may look different, but it's really still all individual specific. So that's just one of my suggestions.
Thank you so much, Giovanna. Now, I do want to acknowledge, I know that we sort of ran over a little bit on our conversation, and we want to protect as much time as possible and respect your all's time. Can we scroll forward just quickly, Becky, and get to the definition section? And if you could just zoom in. And I know we only have about 4 minutes left before I'm going to turn it to Kelly to close this out, but this is just an initial definition that we had drafted as a launching point. And there will be time for future conversation, future feedback. But if you can just take a moment to read this and give us your just quick thoughts of anything that you really like or anything that you feel like is friction or does not sound right, that would be great. And I'll stop talking now.
I have a suggestion with that. I just may add somewhere in there about advocacy, because we are in many forms an advocate for many different clients that we provide.
I'm wondering how you guys feel about the word a paid caregiver. I don't know if you want caregiver. I don't know how you feel about including, is it professional, right, instead of caregiver? And I think maybe when we see like assistance with, is there a way to replace maybe assistance with support, right? Support for activities of daily living. I think because when we say, right, support, that's sort of an empowering word, right?
Darcy, your comments are right in line with what we at the ARC have heard again from.
I got it right?
Self-advocates. Yeah,
So I would much rather see something of a professional who provides. I don't know how I feel about the person-centered HCBS just because I think it's very, very wordy. And we also have been trying to remove the word services from our vocabulary and focus more on the supports.
Does that cut across with aging as well?
I just gave a presentation, an onboarding presentation to MCEs on this call, and they will tell you I probably talked ad nauseum about the word support and using support and like care. You know, yeah.
I'm not sure if I'm sold on the word coaching to achieve individuals' identified goals. Teaching would be better than coaching or something. I don't think coaching is the right word for right there. Maybe I'm wrong, but
Could it be something like supportive guidance to achieve the individual's identified goal? Sorry, a message popped up in front of it. Goal for maximum and optimal independence.
that sounds better. Yeah.
Great. Thank you guys so much for your quick.
I'm sorry, one sec. Can you just repeat that? I didn't catch the supportive guidance.
Supportive guidance to achieve the individual's identified goal for maximum optimal independence, productivity, and community integration. Because we're not teaching them, we're not coaching them, we're showing them easier ways to do things or ways that they can meet it in an ability or that fits their ability. But all we can do is guide them. We can't make them do something.
And I think we also, this is Angie again, sorry, I think we want to make sure that they're integrated and they're included, valued members of their community, right? So once we support them in getting integrated, we want to make sure that they're respected, within their community setting, that they have the opportunity to give back and be productive in their community setting. So I don't know if we can include that anywhere in that definition. I just think that, there's a lot that folks don't realize. Everybody has an opportunity to offer something, right? To give back to their community. And we want to make sure that we recognize that we're supporting that individual in that process.
Right, and see that they get valued within their community once they're integrated into a community setting, that we can value their input into our community.
Thank you all so much for your time and your feedback. We will circulate this document and ask if you have any additional thoughts. We can include this as a running list. This is going to be an active living document. With that, I'll turn it to Kelly to close us out.
Thank you, Courtney. I know we're running short on time. What a great meeting. And I just want to reemphasize, there will be continued opportunity. This is a living document, and it will be shared with you. So thank you so much for your time and the excellent input today. I'm just overwhelmed by the level of participation and the obvious passion. For the next meeting, we're going to ask all of you, and we're going to begin to think about what might make sense for us and for the state as we think about a set of standardized core competencies for whatever title we end up with here. I just said we had the HCBS professional. We've gathered some thoughts on that. So we're going to begin the discussion around the state standardized core competencies as part of our work. And just as it was in preparation for this meeting, the Bowen Center will be in touch, sharing meeting date and time, along with any support materials for your review prior to said meeting. We just want you to know that we hope that you find these action group meetings as productive, offering great discussion. But we do know that there's going to be a great deal of consideration and feedback once the meeting wraps up, or there may be some things that you prefer to share in private. So feel free to send our team an email with additional thoughts and feedback. Now, we are working to identify a specific inbox, if you will, to gather ongoing feedback from this work group. And so we hope to, by the first of the week, have that. So what I will do, you will receive an email from me, and I will share that email address as well as the notes that were taken from today regarding the feedback. So that you will get the notes from today's discussion, from the feedback that was gathered, and you will get information on where you can email any comments and input as follow-up. So we need to think about the next meeting. In terms of that, obviously all of us are busy and we need to protect some time on our calendars. We are looking at early August for the next meeting. So please be on the lookout for an email from Bowen Center with more details. Just quickly, do folks have a preference that we just doodle poll or for each meeting, or would you like to set a regular cadence, say the first Thursday, the last Friday for these sessions? Is there any thoughts on that before we wrap?
Doodle poll.
I heard one doodle poll. All right, well, we'll get together to gather a date, set a date for the early August meeting. Be on the lookout early next week for an email from me with the feedback from this meeting, an email address where you can send your thoughts, and be on the lookout for an email from Bowen as we work to establish the date for our next meeting. So we ran just a little bit over. Thank you all for staying with us. Wonderful day. Wonderful day. Very excited and looking forward to our continued work. Take care.
Have a great weekend, everyone.
Thank you. Have a good day.
Thank
Bye.
you.